Good evening, one and all. We welcome you all to the International Webinar Series on Holistic Health, Well-being and Sustainable Development 2025, commemorating Azadi Ka Amrit Mahotsav, celebrating 77 years of independence, and United Nations Sustainable Development Goals 2015 to 2030, and also Viksit Bharat at 2047, in collaboration with Sri Holistic Health Foundation India and Sri Research Institute Center for Art, Sciences and Wellbeing, and other national and international collaborators as part of awareness and campaigns. Today, we are having a special occasion as we are celebrating and commemorating National Doctors' Day 2025 on occasion of Dr. Bidhan Chandra Roy. Today is both his birth and death anniversary. These are one of the very fortunate souls. You know, people, we have a saying that we don't come taking anything, but while living, we take immense satisfaction. At the same time, as we are born with nothing, we live with nothing. So this is a very rare occasion that birth date and death date also comes on the same day. You know, that also signifies that there is nothing in this materialistic world that we can take, but it all to be in a spiritual way in terms of humanity, compassion, empathy towards each other. So as much as we can contribute, we should be able to do. And this is a wonderful day where we cannot give life, right? We cannot gift a life. And not everyone can do that. So the one who can give a life is known to be the God or Goddess. Now today, we are commemorating wonderful day on this occasion where we are celebrating and commemorating Doctors' Day. And doctors are known and well established to be a highly disciplined, dedicated, committed professional, taking an oath to do service and to put behind everything and put service forward for serving the humankind and all others. So on this day, we all have gathered here to appreciate all the wonderful souls who have come together for this wonderful cause and who are also qualified, certified as doctors and other medical, health and allied professionals. Today is the day to express our gratitude, and today is the day we honor them for their service to the humanity. And today is the occasion, not only just we are remembering them, honoring them, but it's also a day to express our gratitude for being us in times of crisis and in times of joy, happiness, and both in good and bad times. So this day is a wonderful day for everyone to remember, to appreciate, to express gratitude to all the doctors. So with this brief introduction, I would like to begin with this session by the blessings of the Almighty. Let's all take the blessings of Almighty before we start the session.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
With the blessings of Almighty, we shall continue with today's commemorations and celebrations. As we all know, and you all might be aware, that this platform is a unique platform that is organizing various programs and events at international level, national level, regional, and local levels, and has participation and presentation from over 150 plus countries since its inception. Professionals, eminent research scholars, professors, seniors, professors, emeritus professors, research scholars, students, professionals, practitioners across the fraternity have been gracing the platform on various occasions and have been delivering wonderful talks and sharing their knowledge, being part of this wonderful journey. We all are having it together. And this is a platform, we can proudly say, is run by the volunteers who are professionals, highly qualified, and doing wonderful service in their own fields. And this is the only platform where you need not pay anything and no charges or fees is charged for anything, from starting from participation to collaboration. There is no charges and no fees. So that makes it one of the largest commemorating and celebrating platform where we organize events every day. And this is the only platform where there is no discrimination, there is no difference. There is no kind of bias where everyone gets an equal opportunity by following the rules and regulations. So this is a unique platform where everyone gets an equal opportunity to share their knowledge and also to gain the knowledge. And this platform is very well known for its uniqueness. And today we are very fortunate on this occasion to be part of this platform. So once again on this Doctors' Day occasion, we invite each and everyone and wish you all happy Doctors' Day on behalf of Sri Holistic Health Foundation India and Sri Research Institute Center for Arts, Sciences and Well-being. So today, on the occasion of National Doctors' Day, we are remembering Bidhan Chandra Roy, and as mentioned in the scriptures, Vaidyo Narayano Hari, the doctor is Lord Narayana or Lord Vishnu, or for that matter, the doctor is God. When she does his or her duties with sincerity, dedication, commitment, compassion, and empathy, with body, mind, and soul, integrating them by his or her true duty, she becomes the Brahman or Narayan. So when the body is disturbed and afflicted with disease, the medicine is like the waters of Ganges, and the doctor is Lord Narayana himself. That is the highest accord that doctors get, and that kind of integrity the doctors possess today in terms of providing service. And it is our responsibility as doctors to upkeep the integrity, to upkeep the oath we have taken, balancing the materialistic life as well as our duty towards the society. Today is a special day that is commemorated worldwide in different countries on various dates, like national, we have International Doctors' Day, we have World Doctors' Day, and we have National Doctors' Day, which is celebrated in various nations on different dates. So in India, we are celebrating National Doctors' Day on July 1st. In India, a single person inspired creation of their national version of Doctors' Day, who is none other than Dr. Bidhan Chandra Roy, and he was one of the India's most well-known and respected doctors. So every year on July 1st, the life and achievements of the incredible man are celebrated, and the millions of healthcare professionals, workers, patients, medical organizations, and medical fraternity are honored on this day. Doctors' Day go beyond just certain geographic location. It has been observed by many countries for years and honors physicians' contributions to communities. It is observed as a holiday also, public holiday in some countries, by patients, beneficiaries of healthcare industry and healthcare organization. Throughout India, Doctors' Day is observed on July 1st in the honor of Dr. Bidhan Chandra Roy, who, as a legendary physician and West Bengal's second chief minister, who was born in Patna in 1882, who was the eldest son of 5 siblings. Dr. Roy enrolled in the Calcutta Medical College in 1901 before leaving India for further studies. After completing his medical studies in India, stood as a testimony and a stalwart in the profession. Dr. Roy even became close with Mahatma Gandhi during the freedom struggle. At one point in his life, there is a well-known story about how he had traveled to see Gandhi while he was fasting. He refused to take medicine because it was not manufactured in India. Upon hearing Gandhi refused treatment in solidarity with his people, Dr. Roy responded and said that he was to treat someone who had represented his country's 400 million people so fiercely. Gandhi then took medicine and continued his fight for a greater good. One of the things Dr. Roy was dedicated to was providing affordable health care to all people of India. In fact, he was instrumental in establishing several facilities in Kolkata, including the Jodhpur TB Hospital, Chittaranjan Seva Sadan, Kamala Nehru Memorial Hospital, Victoria Institution, Chittaranjan Cancer Hospital, and in 1926 he established the Chittaranjan Seva Sadan for women and children which is considered by many to be one of his most outstanding achievements. The Incredible Life, led by Dr. Roy, inspired by the Indian Medical Association to dedicate July 1st to his achievements and spirit. So, the National Doctors' Day was established in India starting in 1991. So, Bidhan Chandra Roy was born in Patna, Bengal Presidency on July 1st, 1882, and Roy enrolls at the Calcutta Medical College and upon graduating leaves for England for further studies in 1904. Dr. Roy becomes the Chief Minister of West Bengal following India's newly gained independence from medicine to politics in 1925. Dr. Roy establishes the Chittaranjan Seva Sadan, a special hospital for women and children, which is first of its kind in 1926. Dr. Roy is awarded the Bharat Ratna, the highest civilian award of the Republic of India, a year before his death in 1960. The first ever Doctor's Day is celebrated in India in the honor of Dr. Bidhan Chandra Roy since 1991. Since it has the most doctors in India, Delhi has the highest density at 335,000 because it is the most populous city. Mumbai has one of the lowest densities of doctors. Haryana has the highest density among states. So there is disparity among the doctor to patient ratio or doctor to population ratio. Chennai has been dubbed the health capital of India. Approximately 150 international patients are admitted to multi and super specialty hospitals throughout the city. And Chennai attracts roughly 45% of all global health tourists who visit the country and 30 to 40% of domestic health tourists, thanks to the doctors and their efforts. Americans travel to treatment for various reasons, the most important of which is financial. India is a particularly appealing option for American patients because several hospitals provide high quality care from English speaking professionals at reasonable price. A truly remarkable was to and way to observe Doctor's Day is to spread the word about incredible life of Dr. Roy so that we all can get inspired by him. Tell your loved ones about him, share his story, list his achievements, and then let the things he did for women and children and how he worked with political leaders to fight for health care for all. You can track down some content also in your presentations to create awareness. Hospitals can be sad and depressing, so by livening things up with flowers and toys for kids, you will not only create a positive spirit but also honor and encourage professionals that take care of that and treat the sick and the injured. Acts of kindness like have an everlasting impact on people. Doing something simple to brighten a patient's day or making a doctor's day a little more colorful would mean the world to them. We all have our go-to doctors or family doctors that we phone when we need medical care or advice. These doctors stick with us with our darkest moments, and we need to pay them back by showing sincere appreciation. Write your doctor a letter or SMS or email thanking them for always being there to make you feel better and getting you through the tough times. If you couldn't make it in person, at least you can try online or in some way. Generally, doctors are often overloaded, overworked. They work incredibly hard. Overtime is reported by approximately 64% of physicians, some working up to 60 hours per week and more. The earliest known hospital with physicians treating the sick dates back to 500 BC in Sri Lanka, as per the Sri Lankan records. In 2012, the average debt for a recently graduated medical student was $170,000, with the majority of the debt stemming from 4 years of medical school. So being doctor is also an expensive. So this also need to be kept in mind. But at the same time, we should never forget the humanity aspect. Elizabeth Blackwell was the first woman to graduate from a medical school in the United States and went on to establish a medical school for women in 1800s in the West. In India, Muthulakshmi Reddy is one of the foremost surgeons, or we can say foremost doctors, a lady doctor, first lady doctor in India to acquire medical education. In those days, girls were not admitted into medical colleges, and among few, couple of one, Muthulakshmi Reddy from Tamil Nadu was successful in getting her medical degree, and then on she has contributed in various walks of life. So Indian doctors are very advanced, they are highly intelligent, they are very flexible and adaptive, and update themselves with various technologies. The early practice of medicines by physicians in India, especially to the world, our great surgeon and physician, Sushruta, who has performed the first surgery in the world on this planet, always reflects the Vishwaguru, the leader of the planet, of the world, entire world, that India has led, has always been the Vishwaguru for the ages and for the ages to come. So we have the responsibility to continue that legacy. Unfortunately, we are ignorant of our own indigenous knowledge systems, our own sages, and we are following the Western culture, Western literature, which is far behind from our Indian knowledge system. So there is nothing wrong in following, observing any other systems, but you always aim for the best, right? We all aim for the best, toppest, topmost, and the high quality, and the most reliable, with the most validity. So our Indian medical system has proven itself time-tested over space and time again and again. And even today, we have great brains that is ruling the world. So as Indians, we are very proud that we are contributing, and we should continue to do so, and appreciate everyone, whoever is contributing in this field, serving humanity. So this is an important day that honors particular fields and industries like medical, health, and allied health. And Doctors' Day can impact young people searching for meaning and purpose in life. Studying medicine is much more accessible now than before, and many universities worldwide now offer medical studies. We love how this day encourages young people to consider careers in medicine, and it is more humane. Every year in India, when Doctors' Day is observed, the entire country honors the life and work of its most important and influential doctor, Dr. Bidhan Chandra Roy. These celebrations keep his memory alive and inspire many people to live more bravely and with purpose. He was a great man, and he did many important things that helped advance healthcare in India with policy advocacy and framing and strategies. While we do focus in the life of a particular medical professional on this Doctor's Day, we also draw attention to the incredible advancements in medical and health and surgical techniques. India is one of the world's leading countries regarding medical technology and innovation, and that should be honored. India is so much more than a vastly populated country. It has changed the way doctors treat patients and surgeons operate on our bodies, with advancements in the medical field which are being honored and celebrated. So with this, I welcome and invite all the doctors, nurses, pharmacists, social workers, psychologists, and hospital administration staff, and all the participants, presenters who have joined today on this occasion, and those who are watching online on YouTube. We welcome you all once again, and we express our sincere, heartfelt gratitude to all the doctors in the world, not only just on this platform, and medical professionals across the world for their wonderful services and for the sacrifices they are making to deliver their service. Now I invite, we have Professor Ronald O'Donnell from Arizona State University from USA, clinical professor from Arizona State University, and he is working with many countries, especially in India. He is also a veteran, Vietnam veteran, and contributes across the world. So we invite you, Professor Ronald O'Donnell. Now you will be able to share. We welcome you, sir, and we wish you happy Doctors' Day. On this wonderful occasion, we take our privilege to appreciate your efforts and congratulate you and honor you on this National Doctors' Day. Over to you, Professor.
Dr. Ravindra, thank you very much for your wonderful opening talk and introduction. I appreciate that. Good evening to all my friends and colleagues in India and around the world. I'm Ron O'Donnell, a clinical psychologist and professor with Arizona State University. And my focus in healthcare is integrated healthcare. How do we promote both physical and mental health together? How do we help people prevent and manage chronic disease like type 2 diabetes and hypertension, but also address depression, post-traumatic stress disorder, anxiety? And my talk today is going to be about something we're all impacted by. Whether you're in India, in USA, or any country in between, we're all impacted by climate change. And climate change directly impacts our health and our mental health, our well-being. I want to talk about things we can do to help cope, to build resilience with the extreme climate we're all experiencing. Certainly in India, extreme heat, floods, right? These are all common events and more common every year. So I'm going to share a short PowerPoint presentation, and I'll save some time for discussion afterward. Give me a second to pull up my PowerPoint slide here. Just a moment, please.
PPT is useful, Professor.
Maybe 10 years ago, I was asked to do a presentation for a conference in China on green environment. You probably all heard about different countries trying to, especially in urban areas, add more green environments, to add more parks, places to do gardening, to even build gardens into high-rise buildings, because we know when you have a large urban area with lots of concrete, that just sucks up heat, and it's difficult to, it makes heat increase in that community. And if we can add more green environmental space, it'll help to reduce some of that heat impact. And I was asked to do a presentation about green health. You know, how does health apply to green environments? I had no idea about that, but I did some research and found there's a very large body of research showing the more time you spend in a green environment, in a park, in nature, in blue environments, by a lake, by a river, you'll have better physical mental health compared to those who spend less time. So it became clear to me that one thing we can do to help cope with climate and for our mental health and well-being in general, spend more time in green spaces. And that's the focus of my talk today. I always encourage, people I speak to contact me, so feel free to contact me by email, by WhatsApp. And my experience has really been as a professor for Arizona State University, but also as a global consultant in China since 2010, then Southeast Asia, more recently South Asia, some small grants over that time period. But I really enjoy learning about different cultures and how we all globally cope with stress, depression, anxiety, physical health problems, aging. And my agenda for today is talking about the epidemic we're facing of non-communicable diseases, the impact of climate change on health and in particular mental health, how green spaces and time spent in green spaces can help us be healthier, be more well, and a prescription that we as clinicians, it's National Doctors Day, how can doctors, other kind of clinicians, social workers, health workers, how can we prescribe, recommend to our patients spending more time in green environments? So I'll begin with the global syndemic. Syndemic means multiple epidemics. So we're seeing globally increasing non-communicable diseases. They're largely caused by unhealthy habits. Our poor diet, eating unhealthy foods, too much salt, sugar, fat, not enough vegetables, being sedentary, spending too much time in our chairs in front of our computers or looking at our social media screens, not exercising, not being physically active. These are all increasing globally. Mental health problems like depression, anger, uh, unhappiness are all increasing globally. Climate change, of course, we know, and there's not been enough governmental action across the world to reduce greenhouse emissions. So we're facing every year increasing rising temperatures and the impact on all of us for extreme heat, which becomes longer and longer periods of time. And of course, COVID-19 is still in the background. COVID-19 or the infectious disease are still a risk factor we're all facing. So as I mentioned, we know that non-communicable diseases are largely caused by things like diet, sedentary behavior, harmful alcohol use, tobacco smoking. Our unhealthy habits are often a response to stress we feel. We all feel stressed in life, and when we're stressed out, I want to have a nice bowl of ice cream. I want to have a big cup of coffee full of sugar and cream. I want to have a glass of alcohol or smoke a cigarette to calm myself down. But those habits, while they're rewarding and make us feel better in the moment, they actually are not helpful. In the long run, they make us unhealthy. So even though they're short-term effective in helping cope with stress, long-term, they cause more stress by our health getting worse and worse. Psychological problems, as we increase our stress level in society, we're seeing more depression, anxiety. And we know if you have a chronic disease like type 2 diabetes and a psychological problem like depression combined, you have many worse outcomes. Your health outcomes, your mental health outcomes, your cost of care are all higher compared to either condition alone. So if I have depression plus diabetes, I have much worse outcomes and higher health costs than a person with diabetes only. So adding mental health to the mix makes things much worse. And of course, climate change. We see it every day increasing in our life, the impact of climate change. Been a great deal of research on climate impact and mental health, especially extreme climate, extreme heat waves, floods, hurricanes, all these things are increasing, and people with mental health diagnoses are more vulnerable than the average person to the negative impact of extreme heat, having greater morbidity, psychological distress, needing to go to the hospital emergency department more for heat-related illnesses. They may experience barriers trying to find ways to stay cool and hydrated during extreme heat. A diagnosis of severe mental illness like schizophrenia, severe depression, you may be at greater risk for coping with heat because you're cognitive impairment. You aren't really sure what to do about heat, about the need to hydrate yourself and stay cool. Some medications you take for psychiatric problems can increase the risk of adverse heat reactions. And in spite of this knowledge about climate and extreme heat affecting your mental health, most clinicians, doctors, psychologists don't really incorporate how to help our patients prepare for and become more resilient to the effects of heat by doing things they can cope with it. You can do things to improve your coping with heat by staying hydrated, wearing cooler clothes, trying to find ways to find a cooling center, going somewhere in the public where there's air conditioning during extreme heat, using fans. Now, these are all things we can do to help reduce the risk of having things like heat exhaustion. So we need to educate clinicians and our patients how to address climate. Now, in terms of green space, we know that people that spend more time in green or blue spaces, in this photo here, you see on a map a green environment. In this urban city, they built by a river, parks, trees, gardens. Spending more time in those kind of places is associated with reduced cardiovascular risk, increased physical activity, decreased obesity, type 2 diabetes, improved mental health, reduced pain, improved relaxation, fewer biomarkers for stress like inflammation, improved behavioral development in children, and more social support, having others to support you. So it kind of makes sense, right? If you're spending more time, it means you're probably more physically active, you're more focused on your health. Maybe you're going out for a walk with your friends or your partner in a local park. All these things are good. And that tells me we should do more of these things, either in our environments or by taking greener environments into our homes. If I could change my camera angle, I'd show you I have maybe 10 different plants in my office right now to help bring the green into my home, in my own environment. I have a garden in my backyard. I wrote this paper in 2017 describing the impact of green and blue environments on health, and also I'll be covering some recommendations in that paper today. So I'll share my URL here for this article after I finish in the chat screen. Some of the research on pathways between nature and health show our natural environment. If we can increase contact with healthy places like parks, rivers, areas that are shaded, and pay attention to the air quality, being physically active, having social support, managing our stress, we can help mitigate the adverse impact of heat and climate on our own health and do things to improve our resilience. So I use the term green and blue wellness, GBW, green and blue wellness. What can we do to bring more green meaning grass, gardens, and blue, rivers, lakes, even in your home, having a fountain, having an aquarium, having plants in your home are all things you can do to bring green environment into your life. We should do more of that to be healthier and happier. And so we should recommend exposure to green space. We should tell our patients as doctors, you should spend more time in your local park and walking near a river, having some plants in your home. You should address nutrition that's healthier, eating more green vegetables, having more water rather than sugary drinks, sodas, and coffee. You should practice relaxation and be attuned to your environment and have support. Have other people join you. If you do things in green environments together, it's more enjoyable than doing it on your own. So I put together really a grid showing different ways to bring green and blue health closer to your life. So one is simply green and blue spaces. As an individual, you can spend time by plants and gardens. You can even use, your YouTube, and you can see plenty of videos to see videos of forest, rainfall, beaches that are really nice to visualize wonderful places and take your mind to a green space. You can use visualization imagery on your own through meditation. If you have a community, you can go out in your community and try and find a community garden. Many hospitals now have gardens in the hospital, looking for a public garden or spaces. For blue wellness, you can look at having, like I said, an aquarium, a fountain in your home, using, again, visualization or digital media to show photos of rivers, streams, rainfall. And you can do things like going to parks, lakes, rivers, and spending time there. Even taking a shower. People recommend taking a shower or a bath. Experience of water is very refreshing, especially during extreme heat. Physical activity, of course, you have to be careful of physical activity during extreme heat, but in general, doing walking, running, biking, gardening, yoga, Ayurvedic medicine, these are all good things you can do to promote green physical activity. And again, do this with your colleagues. Take a class, join friends at a park doing yoga. For blue wellness, I mentioned you expose yourself to water through your bath or a shower, through drinking more water. Even if you're in a cold area, you can do snow activities, hiking in the snow, snowshoeing, skiing. These are all things you can do on your own or with your community to bring more green and blue spaces into your life and be more physically active. For nutrition, I use green and blue as an analogy for eating green, healthy foods and having more pure blue water without additives. So we need to increase vegetables, especially dark green, red, orange, more fruits, more beans and peas, and reduce things like uh, uh, meat, fat, sugar, sodium, salt on your own, and certainly if you can have your partner, your family, your community, your coworkers join you, take courses in person or online. There's plenty of courses on nutrition available. For blue wellness, I put down things like increasing intake of water or tea, maybe seafood, and decreasing our reliance upon sugary drinks, whether it's soda, uh, coffee with sugar. These are all things we can do individually to bring more green and blue wellness into ourselves by the food and what we drink. And then mind, body, and social support. I've been promoting mindfulness meditation for over 10 years now, and I do mindfulness meditation daily and often incorporate an exercise called mindfulness of the senses, where I'll go back and sit outside and I'll meditate and I'll alternate between meditating on what am I hearing? Am I hearing in my yard birds singing? What am I feeling? Do I feel the warmth on my skin from the temperature? Do I feel a gentle breeze blowing by? Do I smell anything in the environment? Do I smell in the spring maybe the scent of fresh flowers? You can meditate and bring your environment into your mind and think more about that. Even if I'm not in a green environment, I'm not outside, I can go ahead and do this in my mind through visualization. Imagine being in a garden or a park or by a river. These kind of meditation techniques on your own individually or certainly in a class or with your friends are very helpful. So again, I often go to the beach here where I live and I'll see people doing yoga every morning, taking advantage of being near the ocean and being able to do these kind of things together. For social support, we all need support from others. We know loneliness is becoming epidemic also globally. It's increasingly a problem as people are more disconnected, more relying upon only social media, not true human contact. So bringing yourself together with other people to connect with them and share ideas how you can expose yourself to being more active, to be more focused on green and blue health and environments online, finding groups to support you. These are all things we can do to, again, bring our mind and body and our social supports together. So we're focused from the inside to the outside, from our minds to our relationships on keeping ourselves healthy. And last of all, we have a wonderful world of technologies more and more available to us. Things like mHealth, smartphone apps for health, physical health, mental health, activity trackers, tracking how many steps you take, tracking your calories, tracking your exercise, tracking your sleep. These are all things we can do we have wearables now. You can have wearables like your smartwatch, or you can even have wearables now if you have type 2 diabetes to continuously monitor your blood sugar. These are all great technologies we can recommend for ourselves, and if we're a doctor or a clinician, to our patients, using things like smartphone apps for depression, anxiety, meditation, or using our smartphone screens rather than just looking at funny YouTube videos. Let's try and watch videos of wonderful, relaxing nature scenes, whether it's beaches, forest, rainforest, using that to meditate, using our phone for the same purposes. Even biofeedback is more and more available to the average person now to tie in how you're feeling physically to your mental health. So we can use technologies to further bring wellness and green environments into our room, even if we aren't able to go to a local park or river. So in summary from my talk today, spending more time in green and blue spaces, certainly in your environment, going out to walk if you have access to a local park, river, lake, even your own public garden. If not, can you do a small, have plants or a small garden in your home, in your yard? Can you have some water that you're drinking more than soda and coffee? What can we do to expose ourselves to green and blue spaces and to bring healthy green and blue nutrition into our bodies and our mind? That's my prescription for green and blue wellness for all of us and for our patients. And to use technology, the wonderful technology we have to extend these tools for meditation, for managing our physical health and activity as a tool to help us promote these activities. So the physician, in addition to prescribing medication, can now prescribe green and blue wellness. If you're a community health worker, an educator, a teacher, these are all things you can bring to your students as suggestions and ideas. So I hope to promote more of this in my career. I'm gonna stop sharing my screen now. I'm a clinical faculty. I only do research part-time, but I do have history of having some small research grants for training, for example, social workers on integrated healthcare, how to deal with depression, anxiety, physical health, diabetes. And recently, the last year and a half, I've partnered with some of my colleagues who are climate scientists. At my university, Arizona State University, Arizona is one of the hottest one of the hottest states in the United States of America. They have extreme heat almost for 3-4 months of the year. And I've had some of the climate scientists there, as well as some climate scientist colleagues of mine in Vietnam and Thailand. We've applied to 2 different grants this year. There's more and more grant funding for addressing climate and health. We applied for a grant with an organization called Welcome, and our focus was how we can look at training clinicians to improve patient care by training patients to be more resilient to heat. And I did a second grant with colleagues in Vietnam and Thailand on the same topic. How can we help people to learn to spend more time in green spaces and better prepare for extreme heat? And right now, I'm working on a small grant for WHO with colleagues in Bangladesh, and our focus of that grant is how can we help people prepare for extreme climate events that cause infectious disease, right? Flooding, for example, and having too much water, standing water promotes disease through mosquitoes and unsanitary conditions. And it's also traumatic, right? If you experience a flood, you're going to have post-traumatic stress disorder. So can we train community health workers to do psychological first aid during and after an extreme weather event like a flood or a hurricane? So these are all things I'm thinking about, and I think on National Doctors Day, we honor the history of doctors in India. We should be thinking as physicians, as helping professionals, educators, teachers, social workers, how can we promote green and blue wellness in ourselves and in the patients we serve to, if we can't change the climate, at least change how we cope with this. We're more effective in reducing the chance we'll have adverse outcomes like heat exhaustion or heat stroke from not taking care of ourselves. So that concludes my talk for today. Dr. Ravindra, thank you for inviting me today. I'm always happy to join your group. You have a wonderful audience here, and I thank you all for your time. If you have any questions, happy to answer any questions or take any suggestions. So thank you all for your time. Wishing you a good evening in India and globally. If there are no questions, thanks again, Dr. Ravindra. You can certainly introduce the next speaker, and I'll stay on listening for a while. Thank you all.
Thank you, Professor, for joining us on this wonderful, day. And it was a busy day for everyone, but in spite of that, we all have been part of this wonderful occasion. So we once again thank you for your valuable time and express our gratitude on behalf of the platform and all the collaborators and all the participants. And may God bless you with good health, prosperity, so that you can contribute more in coming days. Thank you, Professor.
Thank you very much. And I'll say one last thing. I'm going to post now in the chat the web link to the article I published on Green and Blue Health. So feel free to look at that. If you have any questions, feel free to contact me on that.
Sure, thank you. So
Thank you.
participants, if you have any queries, you can raise your hand. Otherwise, whenever you have any queries, you can share in chat box. Or any appreciation are also welcome. So thank you once again, all the way from USA. You have been part of this wonderful commemoration, and we wish you happy National Doctors Day once again. Professor, thank you. So now we will move on to our next invited guest for the day. We have with us Deepthi, Dr. Deepthi Kiran. She is a multi-versatile personality, and she has a lot of hobbies, talents. A modern day, a projection of we can say the goddess Durga. How she has manifest in different modern day contexts. So we have our, ever young medical professional, like we have remembered our Muthulakshmi Reddy, how she has such a versatile profile. We have Dr. Deepthi with us on this day. She's presently working as, assistant professor in ESI Hospital, Bangalore, Karnataka. And more we would hear from Deepthi. Over to you, Deepthi. Just a second, I will give you permission. Yeah, now you can unmute yourself.
Yes, sir.
We welcome you once again to this platform, and happy National Doctors Day to you.
Thank you so much, sir. It's always very nice to be here, and you're doing such an amazing work, Ravindra, sir. And whenever I listen to you, it's very inspiring. And I am awed by the discipline and commitment you have towards, improving the knowledge and, changing the world for and making this world a better space. I also want to thank Mary, who's been in this journey with me. Uh, Thank you so much. Can I share my slide?
Yes, ma'am. Please go ahead.
I hope it's visible.
Yeah, you can make it full screen. Now it's full screen. Please continue.
Good evening, everyone. I'm Dr. Deepthi. I'm working as Associate Professor in the Department of Community Medicine in ESIC Medical College, Bengaluru. I'm a doctor, I'm a teacher, and like Ravindra sir said, we manage a lot of other roles, because I also believe that it's one life and you can't just have one role. And I always say to my students also that when I'm a doctor, it is not a profession, it is a being. When I become a doctor, even before I recognize myself as a man or a woman, or as a Indian national or a foreign national, or son of somebody, daughter of somebody, my recognition is a doctor. So wherever I am, I take that being along with me. So I need to have a certain qualities when I'm a doctor. Okay. So, and today, uh, like Ravindra said, rightly said, July 1st is observed as National Doctors Day, which is celebrated every year since 1991. That has been 34 years now. honoring the legendary doctor, Dr. Bidhan Chandra Roy, who was a physician, who was a freedom fighter, politician, and also an educationist. Okay, so it recognizes the dedication and invaluable contribution of doctors to public health and medical sciences in India. So it's a great privilege that this day is dedicated for all the doctors. So he was like sir already said, it's on the same day that Dr. Bidhan Chandra Roy was born, and on the same day we had his demise. And today's theme, like every year, it comes up with the theme. So this time the theme is behind the mask, who heals the healers. Okay, so many a times we doctors, unlike other professionals, we don't have any off or something. When the whole world was locked up or locked down during the COVID, doctors always went to work. And even when people fell sick, it was the doctors who succumbed their life first in the COVID. So, but if we look at their health, we have so many plans, we have so many training programs, counseling for other professionals, but unlike for doctors, there is not much. It is taken for granted. If you're a doctor, you need to imbibe that quality of resilience, and you need to imbibe that quality of working hard, of sacrificing your life, and not thinking of your personal life, and dedicating completely to the mankind and to the patients and for serving. But many a times it doesn't work so. If you look at the statistics, the most number of suicide is seen among doctors. It's very unfortunate to see that. And even if you look at the health insurance part, if you go to any corporate sector, every person will have an health insurance. But if you come to a doctor, many of the doctors don't have health insurance. So many a times for minor illness, it's okay. I can just go and ask one of my friend to treat or take care. But when a major thing hits, like a major accident or a cancer or an MI, which requires our stay in ICU, or it requires a major surgery and things like that, they don't have enough health insurance or money saved up for that matter. And also, whenever we have spoken about financial literacy among our medical graduates, it's very less. They're more bothered about other things, but they don't have financial literacy, and many a times they don't know how to manage their finance, how to take care of insurance. Many of them, I'm not saying everybody, but most of the times it is happening. So now we need to think, when people are doing so much for the community, how are these people healed, how are these people taken care of? So it is something we all need to think. And this Doctors Day with the right theme, I think everybody is started to concentrate on health, especially the physical and mental health of doctors, is the main concentration of this year's theme. Like we all know, when we look at the role of doctors in the society, they are the guardians of health. Many a time when people don't uh, follow just like that, but when a doctor says, it is being followed very nicely. Okay, so we are the guardians of health, and we should allow the health to be taken in the hands of the people, because until unless a person take responsibility of their health cannot be taken care of. However, we can only guard the health of the people. Okay, and starting from birth, that beautiful thing of pregnancy and giving birth to life, to death, there is doctors associated. Doctors are not only there only with respect to taking care of cases, patients, but they act as counselors, educators, and nowadays many of them are involved in research also, especially in India. And more than just clinicians, they are looked upon as community leaders, because whatever's told by them, people take it and bring in the change in themselves. So doctors play a varied role, and they're looked upon as community leaders in any part of the world. So if you take a life of a doctor, I want to do a lot of things, okay, but uh, life revolves so much around. See, as soon as I go to the hospital, there is OPD, there is IPD, there's emergency, calls in between. I need to take classes, I need to do my academics. Then, sometimes I have to go early, I have to go late, I have to come back late. Other than my clinical and academics, there are a lot of other responsibilities. Like maybe I want to go and educate a community. I need to do a small research in maybe in a school or a college or whatever. So, whatever toll which goes on a doctor, it is invisible many a times. And if I'm speaking only about the academic or the work burden, but other than that, they have another role. They are a person by themselves. They are like somebody's spouse, they are parent of somebody, they are children of somebody. When such things happen, there is a lot of balance which has to happen in the doctor. And we can't carry what happens at the home and put it on the patient, or what struggle we go through at the hospital, we can't come and put it on the thing. So a doctor's life is very fragile, and a doctors go through innumerous things in just a particular day, sometimes without taking any rest. Like I said, a lot of invisible sacrifices happen. Many a times we can't attend family events. During COVID, there used to be people used to work for 5 days, 6 days continuously, because after that they had to go for a period of quarantine. There would be a lot of sleepless nights, burnt outs. You can go and see sometimes near OT, after ICU doctors, there won't be bed also. They'll be just lying on the floor. They'll be that much burnt out and things like that. Then whenever they are trying so much to take care of the patient and they lose the patient, it has an emotional toll. During my post graduation, when I lost a small girl who is just 8-year old, even today, even after 25 years, it has such a big toll on my emotional health. Whenever I see a small child, no, I take more and more precaution. So it definitely has an emotional toll, because we deal with humans and not with machines. And other than that, like any other field, our medical field is improvising day by day, and being a doctor is our responsibility, that we need to be updated. Just because I'm from an era where I did not know much about computers, I can't keep quiet. If you take radiologists, when I did my medical, at that time there used to be only ultrasound maximum. But after that, now people don't even depend on X-rays. They go directly on CT and MRI. So it's very important for everybody to get updated and learn whatever is happening. So these are the various invisible sacrifices where a doctors undergo. So other than that, we are facing a lot of challenges, like violence against doctors. And sometimes in the hospitals, like what we saw in few of this Kolkata case, there is no proper place for doctors to even take some rest. There is no infrastructure, there are no duty doctors room. Many a times they are overburdened, they can't have a work life balance. Their mental health and of healthcare providers is always neglected, and also the financial literacy also of them is very neglected. These are the challenges we face as doctors. But however, when we come to the community, so our first duty is not to give medicine. Okay, we always see that our first duty is to educate the mass and put their health in their hand. That is what William Osler, who is the father of modern medicine, who has told us. And medicine is a way of like I already said, and I think my previous speaker, Dr. Ronald sir, also spoke about it. So only when you take holistically, all aspects of the health is taken care, okay, then only you can be a good doctor. I always say my students, see, you cannot smoke and tell your students, hey, don't smoke. You cannot, go eat junk morning, night and say, no, junk food causes this. No, you need to be a good person. You need to be a good human being. Then only you can be a good doctor. Okay, and then do not approach the temple of science with the soul of a money change. This is something, again, being a doctor, we never run behind money. Okay, we run behind service, we run behind making changes in the lives of the human. And being a doctor, we don't have that thing, okay, this is the last patient, I am tired from morning, I can't give my full to this patient. I need to give a full irrespective, I can't lose my patients. So as a personality, we change, we learn to communicate. Whatever we are going through, we accept it, we keep it aside, and we give the space for our patients. Sometimes cases like a case of a HIV, or somebody who has to confide whatever they're going through with a doctor. And we as doctors cannot be judgmental. We need to give them that space so that they open up and be themselves. Or sometimes, like my father, he wouldn't take diabetes medication regularly. Okay, so being a doctor, if I'm scolding him and he feels, okay, this doctor scolds me and he doesn't reveal what is happening, then I may just increase his medication and end up in complications of his disease. So it's very important as a doctor that we provide our patients the space to be themselves, to express themselves, irrespective of what we go through. Okay, so we have to be extra polite and we have to provide them with whatever is needed for them. Then, like already sir said, then we have to speak about, mundane for you is important for the patient. For me, I tell everyone, diet, exercise, everybody knows. But as a doctor, when I tell it to the patient, the impact they have, somebody who is not cutting down on the calories, who is not doing exercise, just because a doctor saying, they will start it. My mother has sciatica. How much ever whoever says, she wouldn't listen. Once we showed to a spine surgeon, I said, these are the things to be done. You have to strengthen your spine. Otherwise, we have to go for a back surgery. Immediately from next day, she is going for physiotherapy. She is getting it done. That's the impact. Everybody knows back strengthening exercise has to be done. But when it comes from the doctor, it will definitely have an impact on the patient. Okay, so it's very important for us to not think even small things as mundane, and we have to provide that particular advice to our patients. Then, as a doctor, it's very important we treat our juniors with respect, because good decisions will come from experience and experience come from that bad decision. So if we have learned something from our bad experience, we have to give that knowledge to the juniors, and we have to guide them. This is another thing, as doctors we go through, and we train and mold our juniors as we are going forward in our life. And this is a very important part. I already told you, being a doctor means, then I need to be compassionate. Okay, compassion is empathy in action. Without being compassionate, without being empathetic, I cannot treat my patients with love and care. Okay, so it's very, very important that I am compassionate on my patients. So having sympathy, having passive empathy, and also active compassion, being proactive, is a driving force for any doctor to take care of their patients. So, on this Doctor's Day, thank you, Ravindra sir, for giving me an opportunity, for letting me explain as a doctor what are the things I go through, or what are the things needs to be improved, how a doctor need to be, to bring in a difference among humanity in this community. So be compassionate to be a good doctor. Thank you so much.
Thank you, Dr. Deepti, for the wonderful presentation. We see, because we are also from doctor's family, me, myself, my sister is also doctor. We see a lot of things that are happening in and around, but somewhere down the line, as you rightly pointed out, we also are human beings, like all others, right? We also needs to enjoy, because we also undergo through a lot of emotional trauma, because day in and day out we see wonderful lives coming into this world and wonderful lives leaving this world. That is the most wonderful thing that is happening, and that is the most pathetic thing also that is happening. We see the both extreme ends of the worlds, and a lot of emotion that flows, to the extremes, and we need to manage ourselves. And at the same time, being a woman, as you rightly pointed out, you are also a girl at home, to a mother, and to wife and a teacher and a professor and also a community leader and community advocate. And so many things are happening. We need to balance our life. Often I also see many times, certain videos are trolling saying doctor is dancing without taking care of, responsibility and all these things. See, doctor also is a human being, right? Even a president has right, PM has right, CM has right, scientist has a right. Why not doctor? Why he or she can't enjoy? What's wrong in that? We need to have a different perspective. Definitely. I mean, maybe in COVID time, as you rightly pointed out, lot of stress was there. Doctors were not allowed outside, because they were working with COVID patients. Due to protocols, doctors were not allowed even to homes also. And after their 1 week service, because of shortage of doctors, we were losing doctors also. We lost many doctors. And because of that, immediately after, their duty, they were sent for isolation for such a minimum 1 week period, 15 days period. So they were far from what they will do. They can't be sitting in a closed walls and, be depressed. We need to find our own sources of enjoyment. We need to find our own sources of resilience, So as you rightly pointed out, these are the things that giving us a perspective to understand doctors. Basically it's not that, doctors are, they are also human beings like all of us, like all other professionals. And they also need their personal time, personal space where they can also come openly, enjoy, they can also rejoice, they can also share, participate actively in family, social gatherings, in celebrations. You have rightly pointed out that is very much need. And, not everything and, everyone is, we can't put everything burden on doctors. We need to understand nowadays, as you rightly pointed out, it's a multidisciplinary. Starting from case intake, from the reception till discharge, there are a lot of persons involved, and there is a lot of protocols and there are a lot of rules and guidelines that are taken up. And we have counselors, psychologists, social workers, case managers, so many people working. And we cannot, if something odd happens, we cannot just blame a doctor. First to blame, we have to take it ourselves, because we did not follow what doctor has said. That is a very important aspect where, we need to focus on. And definitely as human being, there are always a human error. It can happen with anyone. Why not with doctor? The doctor can also make mistakes because she is also a human being. So we need to have an empathetic perspective when dealing with issues, when trying to understand. At the same time, we have our own challenges, limitations, as you rightly pointed out. So on this occasion, you have rightly, given a perspective to everyone, at least now those who are attending online and offline. We can at least give a word, give a perspective that you need to look doctors in a different. Everyone, they also have their own life. Personal life is also there. Private life is there. Apart from public life, as a doctor, they have their own life and they have every right, every freedom to enjoy their life, even in private, personal, and public space. So that is very much important for the well-being, holistic health and well-being of doctors who are taking care of the society. So very rightly conveyed, and I think very well it has been taken by every one of us. And if participants have any queries, they can feel free to raise your hand or use chat box. We can unmute you. So I think the way you presented itself was so lucid, I think there is nothing, no doubt in that. So we congratulate you and express our gratitude on this National Doctors Day. And, we honor you on this Doctors Day. And we will be sending you a certificate of honor in a very short time after the meeting. So due to having a busy day, we could not present it online. But
No problem, sir.
apologize
Sir,
for
thank you
that.
so much for the opportunity, sir. Thank
Yes,
you so
thank
much.
you, ma'am. Thank you once again. We wish you all the success and God bless.
Thank you, sir. Thank you, sir.
So now we will move on to our next resource person and next invited speaker, who is also another doctor on this day. We have Dr. Payal Biswasu. She is working for a very great cause in the community, especially in the modern days, where there are a lot of taboo stigmas even in the contemporary society, where we see there is stigma around, breastfeeding, which is very much important. And we also need to have different perspectives here also to understand that this is just as normal as a mother feeding baby. We see a lot of animals, we see a lot of human beings, nurturing their child. And especially in the modern context, though we are highly educated, but there are a lot of issues even in so-called highly educated communities, so-called highly posh malls also. Still people see breastfeeding as something which is not so welcome. So we have Dr. Payal Biswas. She's continuously advocating, promoting, and she's also part of Breastfeeding Network of India and various initiatives at an international level, and she is actively in Rotary also. She is also holding a chair for breastfeeding, and she is doing wonderful service. So we welcome you, Dr. Payal Biswasu, on this wonderful occasion. We wish you a happy National Doctors Day, and over to you for your session. You can unmute yourself.
Yes. Thank you so much, Dr. Ravindra. Namaste, good morning, good afternoon, and good evening, everyone. I'm really delighted whenever I come to your platform. And I'm so happy to be a part of your journey. And I can see that, from past few years, so I will be joining you on and off from this wonderful platform. So I can see without fail, every day you will be sharing something or the other for the community, for the society, for the whole world. Thank you so much, sir, for giving me the opportunity to talk here. So with this, on this special occasion, National Doctors Day, so on 2025, we are here not only to celebrate the profession, but to reflect deeply on our soul. This year's theme, Behind the Mask, Who Heals the Healer, invites us to pause, look beyond appearance, and ask a powerful question. In the act of healing others, do we remember to heal ourselves? So, the mask we wear as doctors, we wear many masks. The mask of certainty, even when the outcomes are uncertain. The mask of calm while racing against time. The mask of strength, even when we feel vulnerable inside. So, behind this mask are human beings. We bleed, we break, we grieve, but more often than not, we keep going because we must. And this is such a wonderful theme because many a times it happens that doctor will be exhausted and will be traveling between hospitals. But if the patient has to wait, they become very restless. They think that why the doctor is not there. So this year theme is for the outside world who are not in a medical profession. And as we say that then there are the wounds, not just physical exhaustion, but emotional fatigue, what the doctors go through. A grief of losing a patient, a guilt of missing time with family, the silent weight of expectation, perfectionism, and relentless pace. These wounds are not visible on scans or lab reports, but they exist quietly and dangerously. So today, let us ask not how many lives we save, but are we saving space for our well being? Are we creating systems where vulnerability is accepted, not judged? As we, as a profession, courageous enough to say, I need help too. Healing the healer begins with a shift. So, what I thought of, discussing today that first the mask we wear, the wounds we hide will be the appropriate title for me to, share in this platform. So, healing the healers begins with a shift from silence to conversation. So, we have to talk from overwork to balance, from glorifying burnout to promote well being, and from carrying burdens alone to sharing them with others. Many a times we have seen, even in with my friends, colleagues, even sometimes with me as well, in order to attend conference, and then we will be traveling, we will be covering more than 4 cities in a day, from Bangalore to Gujarat to Chennai. Again, we will be having coming back early in the morning and then starting with our duties. So this is sometimes it's a huge burden on our health, but we can't say to anybody. So what are the things we can do? What are the things we can practice? So let us discuss some practical, evidence-based, heartfelt way doctors and healthcare professionals can care for themselves across body, mind, and soul. Prioritize our mental health. Regular check-ins with the therapist or counselor, not just when there is a crisis. And I heard that another speaker was talking about that suicidal cases among doctors is on high. So let us try some app or guided practices like mindful coach or to calm ourselves. Let us talk with our peers or friends, normalizing mental health and healthcare breaks that stigma. And we have to set boundaries and stick to them. We have to protect our off hours. Our time is off is as sacred as your time on call. Let us say no without guilt if it's not a medical emergency. Not every committee, shift, or favor needs a yes. We have to use our vacation days fully unplugged. And we have to do something Joy, we have to reclaim joy in small things, as Dr. Ronald was talking about. Doing something that has nothing to do with medicine, like gardening, painting, baking, hiking, photography, or just sitting under the sun doing nothing, looking at the sky, stargazing. Engage in creative outlets. They are proven to reduce stress and rekindle empathy. We have to find or build a support circle. Create a joy in a peer support group, formal or informal. Anything is fine. We have a check in buddy, another doctor, nurse, or friend who knows when we are really not okay behind that smile. We have to rotate emotional labor. We don't always have to be the strong one. Continuous personal growth, like learning something non medical, like music, dancing, philosophy, storytelling, a new language, anything. And journaling or private voice note, like writing a journal, writing that what are the things we are grateful for. It gives perspective and release tension. At least we have to give some time for ourselves every day. It can be morning or it can be, night before going to bed. Advocate for a fair duty hours, wellness policies, staff, safe staffing ratios, and debriefing sessions after traumatic cases. Wellness is not a luxury. It should be a built in feature of the healthcare system, not a weekend workshop. We have to use our voice to inspire change. Speak about burnout, grief, and healing in medical spaces. Your voice can liberate others. We need to mentor younger doctors and encourage them to protect their balance early in life. Self care is so important. Regular 8 hours of sleep, even 15 minutes power nap also helps. Eating nourishing food, not just fast meal between shifts, not Maggie and tea and coffee. We need to stay hydrated, take movement breaks, take stretch between the rounds, and spiritual and reflective anchor. Whatever centers you, it faith, nature, silence, prayer, reading, make time for it. Reflect on why you choose this path. Reflect to your purpose, not just your protocol. Forgive yourself. Not every outcome is in your hand. We have to forgive ourselves. We are human. We are allowed to fall, rest, and begin again. So, and how, if I have to give my example, after my professional things, whenever I get time, I try to spend my professional knowledge with the tribal people, with the Anganwadi workers, with the ASHA workers, with the slum new mothers. I go to villages and spend time with the new mothers in villages and underprivileged area. That gives me mental boosting. That gives me that energy to sustain. So final thought is healing begins with you. Before you extend compassion to patients, offer it to yourself because you deserve it. So, to all my fellow doctors, let this be a reminder you are not just a provider of care, you deserve care. You are not just a professional, you are a person worthy of rest, respect, and renewal. As we honor the legacy of Dr. Bidhan Chandra Roy, let us uphold a new kind of excellence, not just in clinical acumen, but in compassion for ourselves. So let today be the beginning of a culture where every doctor is heard, supported, and sustained, where we celebrate not only our sacrifices but our humanity. And thank you, everyone, for being the strength behind so many lives. And today, may we find strength to care for our own. Happy Doctors' Day 2025. Let us heal together. Thank you.
Thank you, Dr. Payal, for your insightful talk you have shared with us and your observations on life and self-discovery. And we all been observing that, the basic thing is we need to have a holistic approach to one's life. Like we have one health paradigm where we have human health, plant health, and also environment health. So when these three are in harmony, we are able to live in peace and harmony within ourselves and also outside the world. Because we are dependent. We are not independent. We are dependent on plants as well as animals. So we need to be harmony within ourselves, the harmony of body, mind, and soul. We often say, elder says, Trikarana Shuddhi. That means Manasa, Vacha, Karmana. Means our thoughts should be pure, and the same purity then comes to our actions, the way we say, the way we speak, and then it turns into actions. That is karmas.
Absolutely.
The way we do, the activities we do. So why many people who are successful only because they do with Trikarana, the purity of thoughts, that is mind, the purity of their speech, and the purity of their actions. Our thoughts and our talks and our actions should reflect this. Once they are reflecting this, then definitely we will find that solace, we will find that peace within ourselves. Once we are satisfied, see why we are doing this every day. We have set 2 hours, not for anything. This 2 hours every day is we are giving back to society. Every day we have 24 hours and we have 2 hours exclusively through online without no barriers. We are enjoying. Now it has become part and parcel of our life. If there is no session, we will feel something has not happened. My life is not complete this day because it has become part and parcel of my routine, my life now. Because I have to contribute something back to society. Of course, we are also contributing in other hours, 23 hours, 22 hours. But at the same time, we have made a habit. See, that's the power of, habit formation. Initially, there is resistance in having a habit. Once you get habituated, then you love doing it.
Yes.
And that too, it becomes part of your life.
Yes.
I never think, array, today I have to do session. I'm eagerly waiting, as I'm eagerly waiting for doing any other task. Okay, now I have to take up this task. Now this task is done. Now what is next? So we don't see how many people we are reaching, how many people are actively participating. That's all secondary. See, United Nations as such, because we are daily commemorating United Nations Sustainable Development Goals, they are spending billions and millions, trillions of rupees just to create an awareness at a global level with 190 plus member countries, states, that is, in different locations. Still, alcohol, we are not able to, address in a proper way. And, every second, a person is killed by alcohol.
Yes.
A person is killed by tobacco. A person is killed by other, drugs. But we are not able to address in a way that is giving us significant difference. We are able to make some difference. We are not able to achieve sustainable development goals. We have hardly 5 years left. In the 15 years, we have almost crossed our 2/3 of the time. And we have hardly left 5 years to achieve our sustainable development goals. And this decade is also decade of restoration. That means we have gone beyond the earth bearing capacity, the planet's bearing capacity. And we have destroyed so much because of our greed. Planet has everything for our need, but we have gone beyond that need and have created a greed situation without understanding what is our responsibility towards our fellow beings for our planet. Unless and until we understand this holistic nature of this planet as such, we're not able to appreciate. And the more and more disasters keep happening because of our own, because we know this entire ecosystem is a food cycle. You know why? We have predatory system where one species naturally controls the other species. That's why no species are overpopulated, except human beings, unfortunately. No, we see 8 billion plus population, and humans are only one who are overpopulated, not because of their population. It's not because of 8 billion population. The UNFPA, they gave a wonderful perspective. 8 billion possibilities. But what we are doing, are we taking it in a positive manner? Or we are taking it in a very other, way? So that is how we need to understand. And as rightly earlier speakers have said, and Dr. Payal Biswasu is also doing wonderful, the aspect of understanding different aspects of life and different aspects of various milestones that happen, and holistic concept of health. Everyone is talking towards holistic health. Holistic health is not just physiological health. It's about mental health, psychological health, emotional health, financial health, spiritual health, even religious health also is very much required today, because that is a support system where we all get strength from. And today we have science to test whatever we believe in. Though science is still immature, there are beyond certain things, beyond science. But still, it has been time tested. It is coming from ages. Our first foremost surgeon, Sushruta, he has given the world the entire knowledge system. Today we are following them. We have Ayurveda, from where medications come, pharmacy come, pharmacopoeia comes in. We need to leverage the benefits of that by utilizing and leveraging the latest technologies. Yesterday it was in crude form. Now we have refined form, in a sophisticated form. The way we are consuming is changing. The matter is never destroyed. It only, changes its shape. So things are changing because we have some advanced technologies. So we need to adapt them and we need to understand them in a holistic manner. We need to appreciate them across different species. See, when we are appreciating a species, see our dog, when it gives birth to its puppies, how we are able to appreciate. In the same way, human beings, in the same way, other species, in the same way, plants also. And there are offshoots coming up, how we enjoy. Similar way, even our thoughts, even in minds, in positive minds, positive thoughts come up. We need to inculcate that positive thoughts so that we can have this wonderful journey, a life journey, more satisfactory. Today, the world's richest person is also not happy.
Yes.
Maybe he has the wealth. Today, India stands among the top richest billions. In third position, you can remember, India is ranking third in the top billionaires in the world. So we have massive wealth. But India was a wealthy nation. No doubt about it. The history has very well documented it. But now it is coming back as Vishwaguru. So we all need to take part as a contributor, as a potential contributor, positively contributing it. And let's everyone take our share and pride being part of this sustainable development. So with this wonderful way, Dr. Pal has and earlier speakers has contributed. So we wish you all, happy Doctor's Day, especially to Dr. Pal Viswasu. And may God bless you and give you more opportunities to serve more, and especially the kind of vertical you are working. I really see a lot of potential is there. Even a lot of taboo stigma is there. We need to address. Even recently, I also, one of my friends visited a so-called elite mall. There also there is a lot of stigma within the management. So these instances remind us that we have done so many things, but there is a lot more things that we need to do. So that keeps us, motivating that, no, I haven't done yet. So I need to do more. Now there are more challenges.
So here, I just want to share a good news with you. So we are through Rotary, we are setting up a human milk bank in Chikbalapur, which will be helping the rural population of Chikbalapur and Anantapur district.
Oh, that's a great initiative. Congratulations and wish you all the success.
Yeah,
Hope
thank you.
We will have more such initiatives in other districts and all over India also. So,
thank you. It means a lot. Thank you. Thank you so much. Thank you.
So thank you once again for joining us on these celebrations, and we express our heartfelt gratitude and honors to you on this occasion of National Doctors Day. Thank you.
Thank you.
So now I request everyone to switch on your, videos once, so that we'll take a screenshot, and then we will continue with other speakers. So I think everyone has a permission to switch on your videos. So we request everyone, because this is a wonderful opportunity for everyone and being part of it. So whoever can switch on your videos quickly, so that we'll take a screenshot and then you can switch off. Okay, thank you everyone, whoever, have been part of this wonderful journey and memory. So now we will continue with the next speakers. You may, as per your convenience, you can keep your videos on or off. So we will move to our next speaker for the day. We have with us Christina Higan. She is a medical psychiatric social worker from Nigeria. Yeah, Christina, you can unmute yourself. Can you hear me?
Okay, Dr. Ravindra, thank you.
Yeah, happy Doctor's Day.
Thank you very much.
Thank you for being part all the way from Africa, Nigeria. Hope you are having good celebrations there in Nigeria as well.
Very much, Dr. Ravindra, for this opportunity. Can you hear me?
I think there is some network issue.
Hello, Dr. Ravindra, can you hear me?
Yeah, please continue.
Am I audible enough?
Yes, you are audible, but we can't see you. I think there is some network issue, bandwidth issue. You can continue without video, no problem. If it is fine, you can switch on. Otherwise, also it's fine. Because we can see that, there is low bandwidth.
Okay, video.
Fine.
Okay, please, I beg to put off the video so that the network can take us through. Okay, good afternoon, everyone. Greetings to everyone. I'm speaking from Nigeria. My name is Christiana Kigun. I'm a clinical social worker working in the mental health field with over a decade experience. I am pleased to be part of today's commemoration of the National Doctors Day 2025. I am very excited to lend my voice to this in these days celebration and commemoration. The role of the doctors in the health profession or in the health field cannot be overemphasized. And I will say that with the much that they do, they are underappreciated. Most times the doctors, apart from the stress they go through, apart from the work pressure on them, people mount so much pressure on them in the course of delivering their service as professionals. Looking at the role they play in management and care and providing care for the general public, most times they are made to feel guilty. One of the previous speakers talked about the doctors suffer in silence. The doctors don't give themselves permission to be cared for because they feel they are the carers, they are the frontline carers, and then they are supposed to always be strong, thereby putting themselves at risk of suffering in silence. But I will say that such attitude did not just emanate from the thin air. Over the years, from the training to the practical aspects of their profession. Most times, people they're being encouraged to see themselves as care providers. So if you can't break down before your care, the person you are caring for. But I want to say strongly here that I am happy, especially with the last speaker who talked about the role of the doctors, the role of the doctors, and then the importance of the doctors knowing that they are permitted to be vulnerable to. It is okay for them to feel vulnerable and allow themselves to be cared for, especially as they commemorate this great day. And I jotted down some of the quotes. In one of the discussion, I learned or were reminded that care or health is holistic. It's not just specific. So it also entails our physical health, our mental health, our emotional health, our financial health, spiritual well-being, and all of that. And those are the aspects that most times we don't look at as people, but we only focus on the medical health, to the point of ignoring our mental health. And that is why we're having so many issues with stress, burnout, and other psychological issues that should be or that are preventable. I am pleased to celebrate doctors because I have a lot of doctors in my life. My mentor today is a medical doctor. She's first of all a medical doctor, and she has grown in the ranks to the rank of a professor in the field of psychiatry. She has taught me a lot in the field of mental health, and she is still grooming me. And I have a lot. I'm surrounded by a lot of doctors because of my association with her. I have a doctor also in my family. I have doctors all around. So I stand today to commemorate with the doctors as we celebrate the National Doctors Day 2025. And then also I want to say congratulations to doctors and to say thank you for the work you do in providing care for humanity and leading in the field of care providing. And I want to also talk about the importance of doctors in the care providing field. Everywhere in the world, or it is known generally that doctors are leading in the team of health provision. Whether other healthcare providers or health professionals agree or not, it is a known fact that the doctors lead the team of care provision in the health field. So, well, we are being reminded today to say that the doctors need to allow themselves to once in a while be cared for. It is okay to feel tired. It is human to say no when you are not in a good state of health or good state of mind to provide support for anyone. So thank you very much for this opportunity. I will continue to thank Dr. Ravindra, sir, for this great opportunity. I'm from Nigeria. I am happy to collaborate with colleagues and friends all over. And also, I want to say congratulations to all of us as care professionals. Be you a social worker, a psychologist, a nurse, any category of therapists today, we are celebrated because we are unique in our different fields and connected as team care providers. Thank you very much for this great opportunity. I say thank you again, Dr. Ravindra, for always providing us the opportunity to learn and exchange knowledge on this great platform. Thank you.
Thank you, Christina, for your kind words and sharing your observation thoughts on this wonderful day. See, many might be wondering why, especially on Doctors' Day, why to involve other fields. Like every day, we have Social Workers' Day, we have Nurses' Day, we have Pharmacists' Day, we have Health Technicians' Day. But today, doctor is working in a multidisciplinary environment and facing a lot of challenges. So to empower doctor, we need to empower multidisciplinary team. And today, it is a wonderful opportunity where we need to appreciate each other and we need to support each other so that we can all together strengthen doctors. And that is why even other multidisciplinary team is also part of this celebrations and commemorations, where we recognize and we also share, collaborate the responsibilities so that, the doctors who are on the topmost hierarchy in this health delivery, they are provided with much better resources, infrastructure, so that they can provide better quality health. So that's why everyone finds a place here. So we thank you, Christina, for all the time you have been there with us in many of the celebrations and taking time out, joining us and sharing your thoughts. We also express our heartfelt gratitude to the fraternity in Nigeria and African continent. And we thank you once again for being part of this initiative. Happy Doctors' Day to you and fraternity. Thank you. So we'll move on to the other speaker now.
Thank you.
Thank you. So next we have Dr. Chandrakala Diyali. She is Senior Assistant Professor in Amity University from Noida. She is proactive in taking up various academic programs and collaborative activities in academics. And she is also very proactive in research activities and have been actively contributing to the social work and allied fields. So we welcome you, Dr. Chandrakala Diyali, ma'am. You can unmute yourself and start your video and share your thoughts on this occasion. Ma'am, can you hear us? In the meanwhile, anyone else who are not in the flyer, I mean, those where we couldn't accommodate, but who are doctors who would like to share or your thoughts, you are welcome. So I think there is some technical issue at her end. So we will continue with others. So we have Jyoti Makkar, Dr. Jyoti Makkar, who has joined us on this wonderful occasion. Just a second. Let me give you permissions. And we have also Aarti Makkar also. Both are sisters. I think is not there presently. Now we welcome, invite her.
Sir, I'm sharing the PPT. Sharing the PPT.
Okay, ma. Your sister is also there?
Sir, I don't know if she has joined or not.
No, actually I saw her, but I couldn't see now. Anyway, after your presentation, we'll invite her.
Very good evening to all. My presentation is on reversible and irreversible pulpitis. And prior to beginning this presentation, I'd like to say thanks to Almighty God and to Ravindra sir for granting me this opportunity. And also thankful to the wonderful participants. So coming to the first slide, that is parts of a tooth. When we see the structure of a tooth, the outermost layer is enamel, which is the most calcified portion of the tooth, most highly mineralized portion of the tooth. And next is dentine, and the innermost layer is pulp. And so pulpitis, my topic, pulpitis is inflammation of the pulp. So what is inflammation? Inflammation is basically, it is characterized by 5 hallmarks: rubor, tumor, dolor, pallor, and punctualia. Now, rubor is redness, and tumor is swelling, dolor is pain, and pallor is heat, and punctualia is loss of function. So when the inflammation progresses to the pulp, we call that condition as pulpitis. How it initiates? Carious lesion starts on the enamel, outermost layer of the tooth. Then slowly, if it is not treated, it progresses to dentine. And if it is not treated, that time also, it will progress to the third layer, that is the pulp. And that will result in pulpitis. Now, pulpitis is inflammation of the pulp. It's of 2 types, reversible and irreversible. Reversible is which can be restored by filling, restorative procedure. And in reversible pulpitis, what happens? There is a very sharp pain, which happens only as long as the stimulus is applied. And once the stimulus is removed, the pain ceases. And etiology could be caries, dental decay, tooth decay. It could be a faulty restoration, that the tooth decay has been restored, but it is not restored properly. That could be another cause. And it could be trauma. It could be a fractured restoration. These are the causes of reversible pulpitis. And the symptoms are that pain to consuming something sweet, sour, spicy food, and cold. So how do we restore it? We place a filling, which could be a glass, ionomer cement. We could do composite restoration, and we could also go for direct and indirect pulp capping. So these are the treatment modalities for reversible pulpitis. In this case, reversible pulpitis, the decay, it has not approached the pulp. So now this is step-by-step application procedure of composite restoration. What we do in that, first we prepare the tooth, which requires the treatment. Then we isolate the working area. Then after removing the decayed part and isolating the working area, we will do etching. We will place an etchant. We will rinse it. Then we will dry it. We will place a bonding agent. And after that, we will take the composite restoration. The color will be matched with the patient's tooth color. And then we will place it in small increments. And then we will do curing. We will use that laser light. We will cure it. And step by step, increment by increment. And after that, we will do shaping and sculpting. And we will finish and polish it. So this is composite restoration. Another treatment modality for this reversible pulpitis is direct pulp capping. Now, direct pulp capping is when the decay, the inflammation, it has reached the pulp, minor exposure. So we go for direct pulp capping. And in this case, what we do, minor pulp exposure is there, so there'll be bleeding also. So we will attain hemostasis first. We will control the bleeding. We will take a cotton pellet. We will soak it in sodium hypochlorite, and or we can soak it in saline also. We can soak it in chlorhexidine also, and we will press that particular area which is bleeding for few seconds. And once hemostasis is attained, that is, the bleeding is stopped, we apply directly a biocompatible medicament to the exposed pulp. It could be an MTA, which is mineral trioxide aggregate, or we will place calcium hydroxide to the exposed pulp. And direct pulp capping is a vital pulp therapy aimed to maintain the vitality of the tooth and promote the formation of dentine bridge. Then we come to indirect pulp capping. Out here in this indirect pulp capping, the pulp is not exposed, but that that cavity, it is in proximity to the pulp, very close to the pulp. So what we do in that case, same thing, we remove the carious portion, and a small portion of softened dentine, we leave it intentionally so that remineralization of the tooth can happen, and dentine bridge is formed, and before the final restoration is placed. And the materials used are same calcium hydroxide or other biocompatible materials are placed, MTA. Now we come to irreversible pulpitis. Now, irreversible pulpitis is that when the inflammation has reached the pulp. In that particular case, we have to go for root canal treatment. So irreversible pulpitis, what are the symptoms in irreversible pulpitis? There will be very spontaneous pain or exaggerated response to hot and cold in the initial stages, and also to sweet. But in the later stages, when it progresses even more, when the decay spreads even more, inflammation spreads even more in the pulp, then in the later stages, what will happen? The person will feel sensitive to hot, and the temporary relief the subject will get on taking some cold water. And when we do the diagnosis, the tooth will be found tender to percussion, and it may even affect the sleep. So now, in this irreversible pulpitis, when we go for root canal treatment, the treatment modality is RCT. So in this case, what we do first, we excavate the carious portion, excess cavity preparation. That is the first step. And prior to that, we give an LA, local anesthetic agent. We prepare the excess cavity, and then we do pulpal debridement. We remove the pulpal portion. We locate the canals. And then second, after locating the canals, the second step is we go for biomechanical preparation. In the biomechanical preparation, we will irrigate the canal with a suitable irrigant. It could be sodium hypochlorite, it could be hydrogen peroxide, it could be saline, normal saline. And we will clean and shape the canals. And after that, the third step is obturation. Obturation is we place a obturating material in the canals, like gutta parcha. And then after that, the final step is we reduce the tooth structure. And after reducing the tooth structure, we take an alginate impression and we send it to the lab. And then a crown is manufactured in the lab. And then when it comes next sitting, final sitting, we call the patient and we place the crown. So that's all. Thank you many folds. Any questions?
Yeah, wonderful presentation by Dr. Jyoti Makkar. So she is a dentist. There was some technical glitch here. I was looking at that, so couldn't introduce her properly. So very well apt presentation. So nowadays, this dental health is also very much important as all aspects. Because it is generally when we, how we are recognized. The first, when we see someone, what is that we are going to see? Or what is that is more interesting is our face, right? And in that face, the most important part is our smile. The next thing, what is that we are going to hear from them? So that's very important that we need to manage our dental care. And today is also a very important day that all specialties also get proper recognition, proper care on this occasion. And dental hygiene, health and hygiene is also equally relevant today because we are consuming a lot of diet, a lot of foods basically that are causing more harm rather than good to health. Because of lifestyle, the first primary issue is with the lifestyle. We have sedentary lifestyle. That sedentary lifestyle is the root cause. Because what we are consuming is more of junk food, not healthy food, not nutritious food, not easily digested. So accumulation of more fat. So when we are not having that kind of lifestyle, where we do moderate or heavy work, then we are not putting our body at an optimal metabolic rates. What happens? This will lead to accumulation of fat and various other issues. And we don't take proper care of our mouth, teeth, because that is where the first point of contact for food to reach us. So if we don't take care of teeth properly, then we will have a lot of issues. First of all, consuming them and grinding them, chewing them, so that it is easily digestible. And there are various health issues also nowadays because we don't brush the teeth properly. See, most of the time, the problem is not about brushing. The way we brush, more damage is caused. Recently, there are various studies that more damage is caused with brushing. So why that is happening? Because we are not properly brushing. We are putting over pressure. sometimes the gums on the teeth are getting thinner over day, and they are getting damaged because of the way we are brushing, the type of brush we are using, the type of bristles we are using, the amount of time that we are using for brush, and so many aspects are there. So a simple issue or a simple task or an activity like brushing can have so much of impact. In similar way, there are various aspects that needs to be focused on this occasion. I think Jyoti Makkar has provided valuable insights, and we congratulate her for taking her valuable time on this day. And happy Doctor's Day to you, Dr. Jyoti Makkar. And we wish you all the success for your future endeavors. Thank you all the way joining. Congratulations once again. So now we'll move to our next speaker. So we have Pradeep, Mr. Pradeep. As we are talking about One Health paradigm, where it's not just about human health, but it is also about animal health and also the environment, the plant health, human health, animal health, and overall the environment, internal environment as well as the external environment, which gives us the holistic development, sustainable development. The so-called sustainable development is only possible when there is harmony between plants, animals, and environment. Most of the pandemics or epidemics or endemics has caused, these three are different, don't get confused. Pandemics, endemics, epidemics, these three are different, but they differ in magnitude, they differ in scale, they differ in intensity, they differ in quantity and also qualitative aspects. So why we are talking about this is especially zoonotic diseases. Most of the pandemics occurred due to contact with wildlife or wild animals. Improper, negligent contacts or unwanted contacts with wildlife can create havoc. So that is what we need to understand, that when we are not in peace or harmony with the plant and environment life or environment assets or animal life, animal health assets, so we are going to face so many issues like pandemics. So this is one such opportunity where even animal health also plays a crucial aspect of or crucial significance on this occasion, where we also honor the counterpart of multidisciplinary team who is working in animal welfare, animal advocacy. So we invite our next invited speaker, Mr. Pradeep. You can unmute yourself, start your video. To address the gathering and share your valuable thoughts.
Thank you, Ravindra sir, for this. Thank you, Ravindra sir, for the wonderful opportunity. And sorry for there is a technical disruption here. So basically, most of the new emerging infections what are there, so they're all emerging from the zoonotic infection. It's like 74% of new and re-emerging diseases are all zoonotic. So basically, these are caused due to the improper animal welfare measures. So if we take the example of farm animals, majority of them are large in size. So lot of the times they have been kept, these animals have been kept in cramped conditions. At the same time, while seeing the transportation of animals, so especially when we talk about livestock, so they have been transported in a very harsh manner. They are at the same time they are placed one over the other. So they what it happens when transportation of the animals is like if they one animal got infected with any infections, so it will pass on to the rest of the other animals too. So ultimately it will affect to the humans also. We have seen the COVID-19 pandemic. It's not the one. We have seen the swine flu, avian flu, influenza. So there are many other such diseases, and at the same time we have rabies also, which is one of the tropically neglected disease, which is caused by due to the mostly in Asia, it's dog bites. It's dog-mediated rabies, which is particularly common because of the lack of vaccination and at the same time predoming of the lack of animal birth control measures. So these ultimately has increased the rabies deaths. So, and if we talk about the wild animals, so wild animals, especially a lot of the times due to the illegal trading and also illegal trafficking of wild animals. So there's a lot of diseases which pass from animals to humans. So many such diseases we have seen, and at the same time, mostly uh, we have earlier days we don't have much of the this problem, but as the majority of the urbanization is going on, at the same time demand for the food has been increased. So whenever the demand for the new food has been increased, especially when talking about sustainable foods, so mostly the animals have been kept in a, they have been raised as a commodity, not as an living entity. So what happens when at such times is like it often lacks a lack of animal welfare measures, like they kept in a lot of cramped. When you take about a chicken or a hen, or any other pigs, they have been kept in a small barren wise case. For example, for a chicken, it's a A4 size sheet of a paper, so where it cannot stand in itself. At the same time, they have been subjected to a lot of antibiotics and a lot of toxic waste has been when if we came to visit any poultry farm or any other certain conditions. So we see a lot of uh, uh, like nitrogen oxide, a lot of pungent smell is coming out there, right? So at the same time, when the beaks are being trimmed, for example, for male chickens, at this other part of it is uh, a lot of the times uh, these animal waste have been diverted into the nearby water bodies, and they are, so which it causes a lot of pathogenic infections and also typhoid, cholera, malaria, so and then dengue. So these has resulted to the human health also. So what actually matters is in order to prevent the zoonotic emergence, and we need to have the human welfare, animal welfare in balance is One Health. So One Health is a system which is a combination of human, animal, and environment. So there should be a balance approach. So where we need to have the systematic things of like improvisation of the animal health, at the same time taking to the like protecting our environment, which is also matters. So because if there is a destruction of forest is there, so there will be ultimately there will be it leads to affect the animal, and it will impact the human health, and at the same time climatic conditions. We have seen a lot of temperature. Sometimes what happens is when there is any climatic disaster happens, so they will also they pays for part of zoonotic diseases and malaria, dengue fevers. We see the seasonal fevers also, right? So conserving our environment is also very important, because trees especially, so they provide a lot of shady environment, and this product like reduces the temperature and regulate the temperature, and which is very important, which is vital when it comes to the climate change or any other aspect. At the same time, we have forest is one of the important for wildlife and other habitats. So if there is a if there is any lack in that, so it will ultimately affect the not only the one particular species, it will affect both animal and human species too. So there's a lot of studies and reports have been published in papers. If you can Google it, you can get a lot of information about it, zoonotic disease emergence, and uh, many other things which is there. And so many other a lot of countries we have been focusing on One Health implementation, so to balance the environment, uh, human health and animal health, and also sustainability. Sustainable food systems is very much important, and it is vital because through food systems plays a vital role in protecting human health and animal health. And so, whatever my considerations or recommendations is like uh, protecting animals is not only one particular species. It is not catering to only one particular species. It is also important for the human health. At the same time, for safeguarding our environment is also vital. So, with that, I end my uh, talk. And thank you, Ravindra sir, and thank you everyone for so patiently listening.
Thank you, Pradeep, all the way for joining us on this occasion and sharing your thoughts on this National Doctors' Day. Basically, as I have already mentioned, it's how we empower the community by empowering doctors. So, through various ways and means, we can reduce the pressure, the stress on doctors from the community, and we all have an active role to play. Along with appreciation, we need to have a win-win situation with doctors and other professionals, all those who are working in an interdisciplinary team, support each other, appreciate each other. So this is a wonderful opportunity that there is a great need to work on this animal welfare field. Especially environment health, we have been working and many people are working, but where animal welfare is where we really need to work, and where we have to incorporate animal welfare into other aspects. So recently, Ministry of Education also has issued a circular to promote animal welfare associations, animal welfare clubs in various higher educational institutions and other educational institutions, research organizations. So this will help us to create awareness, sensitization towards consciousness towards our fellow beings and species. That means towards our nature and environment. Pradeep has been proactive in creating awareness, running campaigns since almost a decade. So we congratulate you, wish you all the success. We express our heartfelt gratitude to you on this occasion for your contributions, and may God bless you with more opportunities so that you can contribute actively in coming days. Thank you, Mr. Pradeep. We wish you all the success.
Thanks a lot, sir. And a lot of like intersect, as you said, that doctors, so they need to be an intersectoral approach. When it comes to the animal welfare, it needs to be in a veterinary and also the education department, and at the same time, it's a collaboration. It has to be there, and so that every department, transportation department, is also very important when it comes to the transportation of animals. So the everyone has a role to play, it, sir. And, so as you said, right, sensitization is very important, sir. Community sensitization plays a pivotal role in the sensitization public and around especially about the animal health. If we take about the veterinarian, annual vaccinations, which is very important, deworming and other essential things for pet health is very vital, sir. And you also rightly pointed, sir, about the Ministry of Education, about the higher education, promoting about the animal welfare, and at the same time, like including the animal welfare in their curriculum and the projects and everything, sir. So we're welcoming move by the by the UGC. Definitely, sir, it is a right move, and more and more avenues has to be created in the spirit of animal welfare, so that more awareness can be created. At the same time, it is for the beneficiary of the animals and for human health too, sir. Thank you, sir.
Thank you, ma'am. Congratulations once again. And happy
Thank you, sir.
Doctor Day to you as well as being part
Thank you,
of
sir.
multidisciplinary.
Thank you.
Then we will move on to our next resource person and next invited speaker for the day. We have Aarti Makkar. Yeah, Aarti Makkar, then unmute yourself and start your video.
Yes, sir. I'm clear. My voice is clear.
Yes.
I'm
So
visible.
we welcome you on this occasion, and we wish you happy National Doctors Day to you and your family as well. And we congratulate you for your efforts and contributions to the society on this wonderful occasion. Yeah, over to you.
Thank you so much, sir. Good evening, everyone. I'm Aarti Makkar, working as a counselor, educator, and I feel truly honored to be a part of this meaningful Doctors' Day celebration. Today, I invite you to take a brief pause from your busy schedules, not to disconnect, but to reconnect yourself with your breath, with your inner calm, and with your own healing energy. This visual meditation session is specially designed to you, our healers, to reflect, relax, or recharge. As caretakers of others, it is equally important to care for your own mind, body, and soul. So let's take a moment just for your own self, to simple be your own self with your presence and no pressure. Let's begin with meditation and feel being your own self, completely your own self. Close your eyes, feel relaxed, be comfortable. Still close your eyes, be relaxed and comfortable. Please find a comfortable seated position. Breathe in, breathe out. Breathe in, breathe out. Allow your hands to rest in your lap or by your side. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Inhale deeply through your nose and exhale gently through your mouth. Inhale deeply through your nose and exhale gently through your mouth. Breathe in, breathe out. Still close your eyes. Be comfortable. Relax. With every breath, feel yourself relaxing deeper into stillness. Feel yourself relaxing deeper into your stillness. Breathe in, breathe out. Breathe in, breathe out. Let your shoulders drop. Relax the muscles in your face. Relax the muscles in your face. Feel the support of the ground. Let go of any tension. And give yourself full permission to be here in this moment. Breathe in, breathe out. Breathe in, breathe out. Give yourself full permission to be here in this moment. Feel your presence. Be in your comfortable zone. Be yourself. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Now imagine you are standing in a beautiful garden. Relax yourself. Feel the beauty around you. Feel the sky. The sky is clear. The sky is clear and a warm golden sun shines gently above you. You are feeling relaxed and comfortable. You feel its warmth on your face, and on your shoulders. Gentle air around you. You are feeling the blowing air around you. All around you are tall trees, beautiful birds singing quietly, beautiful flowers around you. The nature is approaching you, towards you. Feel yourself, feel your presence. As you walk slowly through this peaceful place, you notice a beautiful river around you. There is a beautiful river around you. You are feeling the beauty of sun, light, trees, river around you. You are composing yourself, your mind, your body, your soul in such a peaceful way. You are loving yourself in very simply way. You are understanding yourself. You are listening yourself. You are hearing your own personal voice. You are feeling your own self. You are here with your own self. Feel your presence. Be comfortable. Relax your mind. Feel how much blessed you are. Feel how much blessed you are. You are having everything with you. You are thankful to the nature, to the universe, to the God for being yourself. Just imagine your all worries are going apart from your life. Just imagine there is a beautiful energy around you which is taking away all the negative powers from you and blessing you a new energies. Feel that blessed energy inside you. Feel that blessed energies around you. Feel that blessed energies around you. Feel the beauty around you. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Feel your body calm and grounded. Remember this peaceful space. Remember this peaceful space. It is always within you. This peaceful space is always within you. Slowly and gradually, bring your awareness back to the room. Wiggle your fingers and toes. And when you are ready, gently open your eyes. Slowly and gradually open your eyes. Rub your hands, keep it on your eyes. Feel comfortable and open your eyes. Meet with your new self. Yes, you all are the beautiful souls. Always be remember yourself. Open your eyes and be comfortable with yourself. Hope everyone can enjoy the session. Thank you for taking this time to care for your own inner peace. May you carry this sense of calm into the rest of your day. Hope everyone has enjoyed the session.
Thank you for the wonderful session,
Thank you, sir.
The topic after which we have taken, especially where we were talking about union of mind, body and soul, and also harmony with humans, animals and plants and environment. I think you have taken up a right session on guided imagery, guided meditation, where we are aware of our, environment, and we are aware of our happenings in and around. That is very much essential. Being mindful, not mindful, full of mind, but being mindful of where we are, what we are doing, and how we are doing, why we are doing, to what extent we are doing. All these aspects is very much important. The 5 W's and 1 H. When we do, earlier also we were discussing, when we are doing with mind, body and soul, and also with recurrent Shuddhi, we say, that gives a lot of interest, lot of engagement, that brings in line with the universe and thoughts of the universe, that will help in maintaining this holistic health. Today we are talking about holistic health and sustainable development, and how doctors as such are and multidisciplinary professionals can take an active role in promoting not only health and well-being of them as doctors or as doctors, but also to everyone. So let's take this wonderful opportunity to express our gratitude to all the counselors, psychologists, social workers, doctors who have been part of this National Doctors Team. We wish you all the success for your future endeavors. Congratulations. We express our heartfelt gratitude that you, as part being of, psychologist, counselor, being part of this celebration. Thank you. So now we will move on to our next resource person, So any other speakers who are ready to Dr. Chandrakala Diyali? Or anyone else who have joined, who would like to share? You can raise your hand. Mary Florence. You can unmute yourself. Start your video.
Good evenings to all. I express my gratitude to Dr. Ravindra sir and Sri Holistic Health Foundation for giving me the opportunity to speak on this platform. I just want to say two sentences that I wish all the Doctors Day, and I am very happy that I started my profession in a medical hospital, so that brought me a lot of memories on this Doctor's Day. So that is my start, and today I'm entering into my 20th year profession. So it's a memorable day that I did here. Yeah, it's a memorable, and Dipti came is like for me a wonderful experience. We spent together 20 years on this field. I thank this the one thing. I wish all the doctors good health, well-being. God bless all the doctors. Thank you very much, sir, for giving me this wonderful opportunity to speak on this platform. Thank you very much, sir.
Thank you, Mary. He's a very dedicated, committed, and by heart, she's a very compassionate, empathetic human being, I should say. Very helpful, very resourceful, very kind, very God-fearing. And I have seen many people, but a unique kind of person, we need to really appreciate on this day. She is also volunteer of this platform, and she almost every day she is part of the sessions actively, proactively, in fact, proactively sharing and promoting the cause. And we really need, this is what we say, manasa vacha karmana. We believe in it, we think about it, we talk about it, and we put into action, we do it. So that is how, she she's almost over 2 decades, she has been doing wonderful service. And whatever she can, whatever tasks you assign her, she's a go-getter, and she does it by heart. That is a unique personality she possesses. So we express our gratitude on this day, for this beautiful soul. Today, she has been part of our platform since quite few years now, very proactive. And she was part in various teams in the health services. Over 2 decades of experience. She has immense insights into various topics. Very dedicated, committed persons, where we need like that, committed, dedicated persons. Today we have all the speakers, especially the senior professors like, Professor Ronald, and, Dr. We have Deepthi, and we have Dr. Chandrakala Diyalu, and Dr. Payal, and so many people today, Aarti, Jyoti Makkar, and so many, those who are trying to make a difference in this world. Not everything starts with a big bang. Small gestures, small initiatives which we take, that create a ripple effect that acts as a multiplier effect, ripple effect that slowly grows on. So let's start today doing that one small amount of goodness, spread the small amount of goodness, happiness, joy to everyone. And let's all appreciate the social workers like Mary Florence, who are immensely contributing in this social work field, not only in health settings, clinical settings, community settings, and so on. So we express our heartfelt gratitude on this occasion to Mary Florence, and also we wish all the success for her future endeavors. And God bless you.
Thank you very much, sir, for your blessings and feedback.
Thank you.
I'll try my level best to do as much as I can, sir.
Thank you. God bless. So now we will move on to next presenter. Who else is there in the list? Okay, though I think we are done with all the speakers. Dr. Chandrakala. Dr. Chandrakala, if you are ready, we can take it up. Otherwise, some other day we can do it. Anyone else who would like to share? I think we can end it here, call it for the day, because we all have a busy day. So we express our heartfelt gratitude to each and everyone, and thanks to everyone, and we appreciate each and everyone's efforts in bringing a better world and also empowering doctors and as well as others. One message I would like to give you is, don't judge individual based on an occupation. See, the greatest disease, the greatest disease of human being is their inability to see the fellow human being as a human, as he or she is. If we are able to see the fellow human being as we are, that's where the so-called ideal world starts. No one wants them to be mistreated, right? We mistreat ourselves in the form of food abuse, right? We don't consume proper, healthy, nutritious food all the time. It's not that every time we use junk food, but our lifestyle, we are abusing ourselves through our lifestyle by not adopting healthy lifestyle. We are discriminating, differentiating others based on various aspects. So today, let's change ourselves a bit where we all can contribute to this wonderful occasion. And we wish you all a happy Doctor's Day. And we appreciate, we congratulate, we express our gratitude and honors to all the presenters, participants who have been part of this. And we'll be sharing feedback form. And we request everyone to quickly fill up the feedback form. And based on the, the details, we request everyone to quickly fill the feedback form with all the details correctly so that we can prepare certificates and share you through email. So the link already which has been shared along with your invitation or message, it contains the website link from where you can download the certificates. So based on your participation or presentation, you will be provided with certificates. So kindly fill the feedback form which has been shared in the form of votes. So those, if others, anyone would like to talk, or if you have any feedback, feel free to share in chat box. The feedback form has been shared. So we thank each and everyone once again for being part of this and keep joining us. The certificate is just, I keep saying to many people, certificate is just a piece of paper, or nowadays a piece of a file. So how we are contributing, our commitment, our dedication, our sincerity, our obedience. See, we may have these three, but lack of obedience, lack of loyalty towards ourselves, our own selves, will create issues in our life. So keep attending daily. We have the records, who is attending, who is not attending, how much time they are attending. And this is one of the unique platform. So don't think that I need a certificate, I need to join, I'm not getting certificate. Certificate is not at all priority. Not for anyone. No one is, especially volunteers, they don't even expect a certificate. Yeah. Certificate will come because we have a systematic process and we are not doing it for any name or fame or for any other thing, right? We are not taking any funds. We are not inviting any sponsorships. We don't take any funds from anyone, any individual, any organization, whether it's a private or government. We are doing as part of our service, giving back to society. There are many organizations which do it for name, fame, or for various other purposes. They have a different practices, but we are not like. This platform is unique. We have a set of instructions, ethics, morals, and based on that, most importantly is discipline. Where we have persistent, consistent discipline that is maintained. As per that, we have set of rules and regulations. We continue doing that. And we are very particular with respect to formalities because that saves time. With these busy schedules, I wake up around 2:30 in the early morning. 2:30 in the morning, and I need to complete all my rituals, religious, spiritual, and I need to attend to my day-to-day activities. And I hardly get time, daily now, just immediately after coming to my place from my other place. Now every day we are sitting, we are spending time, and then we need to, again, we have pre-activities, pre-webinars, pre-series activities, and post-series activities. So all these we are contributing. We are spending our valuable time, resources, all of us, not only just me. Main thing we have to understand is we are having limited resources. In that sense, we all have 24 hours, but we are able to do, some are able to maximum utilize the 24 hours in different ways. It's all about priorities. What I say is, on this Doctor's Day, finding time is more important. For doctors, getting time is very difficult. People say, we have seen many suicide cases in doctors. We have seen many broken families in doctors because spouses are not happy with them. Family members are not happy with them. Relatives are not happy with them. Friends are not happy with them because of the time, because they spend more time with patients. A general population think that doctors should give most of their time to patients, attending patients, delivering services, health services, healthcare services. But she is also a person like all of us, right? And they also deserve their time, their leisure. So similarly, we all need to be more disciplined in our life so that we can achieve more. Why? Because we want to see everyone flourishing, nourishing themselves. So on this Doctor's Day, I wish we all are more disciplined, more empathetic, more compassionate, more dedicated, more committed, more resilient towards ourselves and towards others, and follow rules and regulations, the land of law. The rules and regulations of each organization is different. So we need to follow them in time so that we can get the benefits to the fullest extent and leverage those benefits. So I invite you. This is a wonderful opportunity. We all are very fortunate to be part on this platform. Utilize this platform. Every day there are sessions, commemorations happening on. Don't see about the number of participants. What I say is, it doesn't matter. I'm sitting, a very senior multidisciplinary professional. I'm a psychologist. I'm a social worker. I'm a philosopher. I'm a spiritual mentor. We are performing so many roles, not just me. Everyone you have seen, who are coming on this platform. Even one person say, I am there every day. No, Mary is there every day. And so many people are there every day. They are listening to you. They are praying for you. They are wishing for you. Doesn't matter. What is the use of 8 billion people if they are not productive? They are burden to the planet. Now, everyone, God is blessed everyone to contribute. Everyone can contribute in one way or other. Whatever way you can contribute, try to contribute, be more productive to the world. In that way only we can contribute. But unfortunately, things are not that way. Do whatever you want to do, however you want to contribute. Contribute. The least you can do is whatever knowledge you have shared, you can share. Or you can support those who are sharing their knowledge. And by sharing your knowledge, you will never lose knowledge. Whatever knowledge you have, it will be there with you forever. No one can steal that knowledge from you. By sharing, you will be putting a good use of that knowledge. You will be gaining more knowledge through interaction, through discussion, through debates. So keep sharing knowledge, utilize opportunities in a proper way, and we wish you all the success on this National Doctors Day. Do support doctors. And there is also, I admit, there is also a human error, sometimes also negligence, but that is quite common in all professions where there is no negligence. But here, because lives are matter, the negligence costs lives. Why that negligence happens? Because due to various factors we were discussing today. Doctors also get, frustrated. They also get disheartened because they are not able to satisfy themselves and also the patients because of limited resources, because of limited infrastructure, because of various other aspects. So we need to support them. We need to motivate them. We need to encourage them so that they are more productive and more contributing to the society. So with this, I will not take much more time. I congratulate everyone. We express our heartfelt gratitude on behalf of Sri Holistic Health Foundation India and Sri Research Institute Center for Art, Sciences and Wellbeing, and all the collaborators. We appreciate all the presenters for joining us. And before leaving, we request everyone to quickly fill up the feedback form and keep joining us daily with the same joining link whenever you can. And don't worry about daily certificates. One day you may get, one day you may not get, but you are part of this in the process of making history. We have already created history, and this is the largest commemoration. No one is doing that. You can verify it. So you are part of this wonderful journey. Embrace the journey and contribute. Keep spreading your word. There are no charges for presentation, participation, collaboration. If you have an organization, you come forward. We can collaborate with events. So we will take care of everything. You need not worry. We'll give you a platform. We will take care of all the technical support. If you want resource persons also, we will arrange. And we'll do it everything for you. Don't worry. If you have an intent to do something good to the society, we'll help you in organizing sessions in your colleges, universities, or communities also, online and offline, Offline, we are doing very limited because we have our own schedule and because of time constraints. Online, we are able to give time because we save time in traveling and all other things, right? So we prefer more online unless and until there's a real need, that kind of need where our physical presence is required. But I truly believe, wherever we are in whatever mode, it serves, as long as it serves a purpose and we can use the same resources for other things where it can be more productive. So we welcome you all, we invite you all to be part in the upcoming events, programs. We can collaborate together and we can create a more sustainable, more empathetic, more compassionate, more human planet. So thank you once again, everyone. Take care. Good night. Namaste.